metabolism can then cause weight loss, and a high metabolism can also cause an extreme appetite. And then to the right, you see shakiness. So the high pulse rate and rapid breathing and high metabolism can cause shakiness and nervousness and irritability. And so all of these physical or biological symptoms that are occurring can then also cause social and cognitive problems like nervousness and irritability. And many explain that they have what are called emotional highs and lows. So their emotions are kind of going back and forth and extreme in one sense or another because maybe of their high pulse rate or their rapid breathing or overactive thyroid gland that is regulating lots of things going on throughout the body. And then finally, sleep use can come about from an array of all of these. All of these problems can certainly cause sleep issues, but a high metabolism, if at night, or a high pulse rate at night, can definitely also cause sleep issues. So a lot of the symptoms of Graves' disease or hyperthyroidism are related to an overactive gland. And also what I would like to note is that those who have Graves' disease quite often are not diagnosed by doctors because these symptoms are actually not very outwardly visual or visible symptoms. So maybe what I can view or what one can view as stress, for example, someone who has going to school or has a high stressful job or has an autoimmune disease, can have a poor way of dealing with stress or have stress, and then their stress can be seen, or their symptoms of Graves' disease, so their high pulse rate and their lack of ability to sleep or their nervousness and shakiness they can say that these symptoms are because of their rest or their job or an array of things that are going on throughout their life. And so Graves' disease is very underdiagnosed and just unaware by a lot of people because the symptoms are very normal to an individual who is in a high level of stress. So with this image, I wanted to show the compare and contrast of a hypothyroidism or an underactive thyroid gland, or hyperthyroidism or Graves' disease, which is an overactive thyroid gland. And so what we learned at the beginning of this course is that whatever direction the production of hormones or productions of hormones is going, so the thyroid gland is overproducing a thyroid hormone, then we are having an increase of heartbeat. And so whatever direction the production of the hormone is going is the direction of the symptoms that we are going to see phenotypically with the disease. So someone with hypothyroidism is going to have a loss of hair and a slower heartbeat and gaining weight because their metabolism is significantly slower. And so constipation versus diarrhea because their metabolism is much slower. And in the other, to the right, hyperthyroidism or an overactive thyroid gland causes a rapid heartbeat and sweating, so an overproduction of sweat glands and weight loss because of an overproduction of the metabolism and frequent bowels because of the overproduction of metabolism, and tremors on fingernail tremor of fingers because of the rapid heartbeat. And so everything is directly related to the over or under production of the hormone that's going on because of the autoimmune disease that is coming in and attacking the body, attacking the thyroid, and in Graves' disease's case, telling the thyroid hormone that we need to produce more thyroid hormone for the body. There are many kinds of treatments for Graves' disease and thyroid disease. One of them, which does not seem to be very safe or appropriate, is a radioiodine therapy, where a doctor administers iodine orally to a patient, and the iodine kills off the cells throughout the thyroid gland, but does not affect anything around the thyroid gland, and just influences the thyroid gland because the thyroid gland needs iodine to produce thyroid hormone. Another kind of treatment is the removal of the entire thyroid or parts of it. This can happen in the case of cancer, or if medications or other treatments are unable to give any results. And there's also anti-thyroid medication, or also beta blockers, and these are medications that go in and block or minimize or limit the amount of thyroid hormones that are being produced, but they're not actually solving the problem. They're just cutting in on that thyroid gland part in the previous slide and stopping the production, going back up to the pituitary gland, but they're not actually medications are not actually solving the problem of the immune system and the pituitary gland and the presence of the TSI, thyroid stimulating immunoglobulin, being added into the thyroid, and why that is causing that antibody to be being produced. So far there is no way of stopping the antibody to being produced, but there are ways of stopping the thyroid if there are cases of extreme overproduction. But since Graves' disease is an autoimmune disease, and it is not a disease of the thyroid gland, not a problem that's happening in the thyroid gland, but is influencing or altering what's happening in the thyroid gland, then improving the immune system is the best way to get to the root of the problem. And so the ways of influencing the immune system could be to have stress reduction and increase in exercise, and many doctors have provided natural supplementations of echinacea and selenium, and so on and so forth. In conclusion, Graves' disease is an autoimmune disorder that is one kind of, and the most common, hyperthyroidism disease, and this can be beneficial in future research since it's the most common. What I found through my research of Graves' disease is that each individual case is different from the next, and each person experiences different symptoms and has different results with different treatments. And what I've found that people have explained or advice to others is that everyone should do the research for themselves and find out what works for them. For example, making diet modifications or treatment modifications or lifestyle changes or whatever that may be, and seeing what improves their their um, their symptoms and what improves their emotional states in regards to Graves' disease. I've found that Graves' disease is really probably underdiagnosed because the symptoms are so common to that of stress um, and also it's a largely female-based disease, and so that may be even more reason why women are not seeking diagnosis or treatment. So the future of Graves' disease hopefully can go towards women being more aware of the presence of an abnormal thyroid gland and going to the doctors and being diagnosed so that they can better understand their symptoms that they're experiencing um, and not assume that they are because of stress or personal problems. So lastly, Graves' disease has to be solved somehow in the future through the understanding of autoimmune diseases and the immune system rather than the thyroid gland. Once research can be put forth towards understanding the presence of the TSI, thyroid stimulating immunoglobulin, and its presence from the immune system into the thyroid gland, then more can be known and found around how Graves' disease influences the thyroids and how it can be solved.